So thank you for the opportunity to tell you today about a quality improvement project which we conducted within routine general practice about trying to implement a musculoskeletal and sports and exercise medicine clinic into routine general practice. The reason we chose this area is the fact that musculoskeletal symptoms are extremely common within primary care. They make up about a fifth of our workload, and there's often GP uncertainty in managing these symptoms. Within the current healthcare ethos, we're now having a shift from hospital-based management into the community, and within Northern Ireland we have Transforming Your Care, and that's about producing the right care in the right place at the right time. So bearing that in mind, our aim was therefore to develop a reproducible, patient-focused and sustainable GP staff musculoskeletal and sports and exercise medicine clinic based in routine primary care. We chose one GP surgery that looks after 9,000 patients, and there's 5 GP partners in that surgery. The clinic was staffed by one GP with a specialist interest in this area, and it was a monthly 4-hourly clinic with 20-minute appointment times. All staff in the practice could refer to the clinic anyone who they were basically uncertain about and that they were going to refer to secondary care for further input. And we reviewed their outcomes over 2-3 month time periods. So we saw over 80 patients, the majority of whom were female, and the age range was 26 to 77 years of age. The commonest joint presenting to the surgery was shoulder, and with regards to patient satisfaction, we assessed it with 10 questionnaires randomly allocated to patients attending the clinic, and all were extremely satisfied with the service that they received and said that they would prefer community over hospital-based management. All patients were seen within 4 weeks, and from those 83 patients that were seen, there was only 5 onward referrals from them. With regards to referral rates, so we compared the same time period but in the previous year. So the only variable that was changing was the fact that we had implemented this new clinic, and overall referrals from the practice were reduced by about 150 at both time periods. X-ray referrals and physiotherapy referrals were reduced, and also orthopaedic and rheumatology referrals were reduced. With regards to the economic impact that this clinic can potentially have, we costed the different options, so orthopaedic ICATs and hospital outpatient appointments, and there's a potential saving here of between £1,700 and £12,000 per 83 patients reviewed, depending upon what avenue you went down. So in conclusion, we present a novel service model which is patient focused, it appears cost effective and provides high patient satisfaction. We think it has significant future with regards to the rollout of the clinic within the local area via the local commissioning groups, and also has the potential for research here.
Thank you, Neil. Any questions?
Do you think this model will work because it was all based on the same GP practice, or do you think it would work in sort of a federation kind of thing, or do you think it was the fact that it was all interacting within the same sort of same staff, same people knew each other? Yeah. What do you think that happened?
I think there's various variables at play. I think certainly from the patient satisfaction questionnaire, one of the things that the patients found very helpful was having that expertise within their own surgery. The fact that they weren't travelling to a hospital, parking in something they had to pay for, and all that sort of travel. So I think that was a big factor. And you know, I think then with regards to the actual expertise of the clinic, the patients very much appreciated that. So having it within their locality with that level of expertise, that's what they really appreciated. And I think that's why it was successful.
Thank you. Enjoyed that interesting project. I guess inevitably I'm going to ask, is this the only model that you're looking at? Because I guess in other areas of the UK you would see, yes, the physios looking in this way, or other clinicians, and I wonder if you were going to further research this. Yeah. Whether this is the only model that you're going to be researching.
No, I mean, and I think that's my last point with regards, you know, the future for it. You can look at bringing different professionals into it. You can look at providing different services within that clinic. But I think, you know, to do what Simon Stevens is talking about doing, we have to provide them with the evidence that it works. And so I would say do it in a small area with these different professionals, different services, prove that it works, and then roll it out into, you know, the larger areas. So I can see a lot of potential down different areas for it.
Thank you. I mean, as a strange sort of rheumatologist that's worked a lot in primary care. I just wanted to ask you about the sustainability of the model, because in my experience these things work well when you've got an enthusiastic GP or an enthusiastic physiotherapist, but they're very dependent on that individual, and sadly what often happens is that individual moves on and the service stops. I wondered what you're putting in place in terms of training, for example, to build capacity.
Well, I think that's one of the interesting things that actually came out of the project was what types of conditions are you seeing in the clinic, and therefore taking that uncertainty away from GPs, training them in the conditions that are coming out of this clinic to then provide someone to come along and replace what I'm already doing. So I think that's part of it we have to learn from this previous experience. I mean, at the minute this is only in one surgery, so we've not looked in depth at that, but that's what we would hope to do in the future.
Yeah, because the worry is that you actually de-skill the other GPs rather than train them up, because you're taking the patients away from them.
Well, I mean, certainly we're with regards to this surgery, we're feeding back to the GPs, and hopefully, with time, we can then move on to another surgery. They're trained up in the things that are coming into this clinic, and therefore they take the place of myself.
Great. Thanks, Neil.
Thanks.